and welcome to this segment of North Valley Viewpoints. I'm your host, Linda Watkins Bennett. Today's topic is hospice care, and we're pleased to be joined by Dr. Sam Brown, who is Medical Director for Butte Home Health and Hospice, also Bronson Pittman, who's a chaplain at Butte Home Health and Hospice. Thank you both for being with us today.
It's
We
good to be
really
here.
appreciate it. Hospice is a term many people may have heard, but unless they've had direct experience, they probably don't have an idea of what it really is. So I guess we should begin by explaining what it is.
Well, let me give you a little concise definition. and basically, hospice is a medical program, and it's Medicare funded, although other insurances do cover it. But it's most often Medicare funded, and usually the costs are paid in full. And it's a program designed specifically to provide comfort measures for people who have end-stage disease. The doctor, myself, and their primary care doctor would have to anticipate that they might have in the range of 6 months to live. We focus on pain relief. We don't believe anybody should die in any significant amount of pain. And all the other symptoms, whether they be shortness of breath, all of these are pretty much treatable and resolvable with the proper treatment. And then what's critically important, we attend to the psychological, the existential, the spiritual needs of the patient. And what I want to really emphasize is that people can experience extraordinary psychological growth during the last phases of their life. When time is limited, people act very quickly very often. Bronson, you may want to add some.
Right, I think one of the most powerful components to hospice care is that people oftentimes with a life-threatening illness feel like their lives are out of control. They're oftentimes spending a great deal of time in the hospital setting, going back and forth for tests and treatment. And when a person finally is able to take control of their medical care by being in their own home, receiving the support that Dr. Brown spoke about, it really gives that sense of empowerment to a person that I'm going to determine how my days are going to go in these last months of life. And it also gives a lot of support to the family because hospice is designed to be holistic, caring not only for the person who has the life-threatening disease or illness, but also for family members who are at their side to provide care.
And making it as your last days, full of quality.
Right.
And obviously being comfortable and just a peace of mind, I think, is really what everybody's looking for.
To retain your autonomy and dignity and to die peacefully, I think is a right that most people have. I want to add one other thing, if I might, and that is, Art Bookwald, you've probably seen some segments on him. He was in hospice, and actually his renal function stabilized, and so he was discharged. And I want to point out that people often get in hospice, and then they stabilize, and you can leave hospice. Some people feel that when they get in, somehow they may have to stay.
Right,
But if you improve and stabilize, you can be discharged. There's no problem with that.
Would you say it's kind of a misconception that people view it as maybe, when you give up, it's not really giving up, right?
Exactly. And part of it's a misunderstanding around hope. Doctors will often say, well, I don't want to bring up hospice because it may remove hope. When people know they have limited time left and they're really very ill, basically they shift their hope to different types of things. They hope for having a peaceful death, for not being in pain, for seeing close relatives and resolving certain issues. So hope always remains, but it just shifts in its emphasis.
Okay. Now, I presume there are different forms of hospice treatment, if you will, or plans or programs. Obviously, there are probably many different individual needs, so this has to be very flexible.
Hospice is flexible in that what counts as a home, for example, is wherever the person is living. We do care within the privacy of one's own home, but also in residential care facilities, assisted living facilities, as well as skilled nursing facilities. Hospice is able to provide support in all those different contexts.
So when or even where is the referral given to someone, or the suggestion usually presented that you look into your hospice options?
This is a really important question because it's actually a problem in hospice that the referrals to us are often late. And ideally you would expect it to come from the physician or the hospital, which it sometimes does if somebody is not doing well and they realize they need hospice. But basically your primary care physician is the one that's going to refer you into hospice. But very often it's the client and the family that really needs to bring it up. There's a very interesting study that shows the more your doctor likes you and the longer he's known you, the less likely is to refer you to hospice until it's very late. And so doctors are subject to denial like everybody else. So in essence, the family can bring it up, the primary care physician. You can even call our agency and ask for some help in how to get into hospice.
Is it for people with cancer? Again, we talked a little bit about your situation may improve.
Right, and so hospice does cover a wide range of diagnoses. While traditionally people think of hospice care as for people with end-stage cancer, it also is for those with end-stage heart disease, end-stage dementia, and a variety of renal disease and so on that qualify. Any life-limiting illness in which the physician believes that if the disease follows a normally expected course, that person's life expectancy would be 6 months or less. That is what Medicare, for example, requires the physician to agree with.
And when you enter into hospice, is there normally a one-on-one relationship with one hospice worker? Is it a team? Is it, do you have different people assisting you through the process?
It is truly a team. We have our nurse that goes out, initially does the evaluation and evaluates the situation, what the patients need. We have a nurse manager that is a constant in the care. And then we surround this with a team of specialists, of doctors, chaplains, speech therapists, dietitians. So we bring the whole resource of medical knowledge into that person's care.
It does sound like it would be costly by today's medical standards, but again, this is often covered by...
Well, that's also an important point. Yes, it is Medicare, and there are private insurances that cover it, but all hospices are highly dependent on donation. It's difficult to break even, but it's such a worthwhile field that most people you find in hospice are extraordinarily dedicated human beings. So donations are important, but yes, it is covered by insurance in most cases.
And you have to, compassion really would be key for anybody who's working in hospice.
Right. You feel we have a consistent group of staff who really feel this is their calling in life, to be a part of families who are sharing this journey through the last part of life together. And so we have a dedicated team of people who establish that rapport and maintain that one-on-one relationship, so that you're not just seeing a whole lineup of people who come and go throughout the time that you're in hospice, but you're seeing the same faces day in and day out, week in and week out through your time of care.
And I imagine some very close relationships are forged in that process.
Yes, very much so. You grow very attached.
Close. And by the way, I should mention Bruce Bronson takes care of this. We offer bereavement services, as all hospices, for a full year after that person passes away. So there's really a lot of support after the person dies.
All right, a lot of ground covered, and we have a lot more to go. So we're going to take a break, and we'll be back with more about hospice in just a moment. Hello and welcome back to this segment of North Valley Viewpoints. We're talking about hospice care, and we're joined today by Dr. Sam Brown, who's Medical Director of Butte Home Health and Hospice, also Bronson Pittman, who is Chaplain at Butte Home Health and Hospice. And thank you both, gentlemen, for being with us today.
Good to be here.
We've kind of explored already exactly what is hospice, and Dr. Brown, you gave me a kind of an idea of how many people nationwide might be taking advantage of it.
Right. I think the figure is, if you look nationwide, there's about 2.5 million people who die per year, which is an extraordinary number. And maybe only between 25 and 30% will take advantage of hospice. And this is really a tragedy in so many ways. It's Medicare funded, so people can really afford it. Medi-Cal has a benefit, as well as other insurance companies. And actually, a thing I didn't point out before is the treatment at end of life is really a specialty. And the type of pain relief and the kind of approach we take is rather unique. And so to get the proper type of pain control and to control the other symptoms that people have, you need somebody with a fair amount of experience in this field. So yes, we have pervasive number of people involved in it, and every other week, all of the specialties get together and we discuss every patient in detail to make sure we're making the kind of progress that we want to make. And you may have something to add.
Right, and I think kind of touching on that as well, is if asked, most of us, if we face a life-threatening illness, would rather be in our own home, supported by hospice care, rather than in a clinical setting like a hospital. And yet those statistics show that it's exactly the reverse of what most people would want, that they end up in a hospital in acute care with family members struggling to be present with them, rather than in the comfortable surroundings of their own home environment.
Absolutely. Just to emphasize that, the basic figures are that 90% of people want to die at home. And actually maybe only 20% die at home. And the other thing that can happen, which is inadvertent and not really anybody's fault, but if you're elderly and have an illness that's not curative and you end up in the ER and in that acute medical system, you may end up on machines, undergo an extensive, somewhat painful and uncomfortable type of treatment, and actually extend the suffering that a person experiences. So that's something you'd want to avoid at the end of life if you could.
What do you think is a barrier to more people taking advantage of hospice services?
You know, I think we're getting better, but you know, there's a death-phobic society. We have difficulty talking about it, and actually doctors may have a healthy dose of that. A lot of our training, I think the younger doctors may be escaping this, but during my training, I'm 70 now, so I'm thinking seriously about hospice. But in our training, our orientation was all about cure, getting people better, and actually we really didn't discuss people dying. And I remember so poignantly now that when I was on rounds, when I was a young intern, and there was a patient in the room dying, we often didn't go in the room. We would talk outside the room and talk around the subject of what was going on. So partly it's that discomfort about talking about this vitally important part of life.
So maybe start the discussion early.
Right.
If you are ill, especially, but some things come on abruptly and you're not expecting them. But have these conversations, I guess, with your family and your physician early on about when it does come to this point.
I think that's an excellent idea. And you know, I think what's happened in so many fields today, I mean, the consumer has to be educated today, and I hope we're doing some of that today. But, you know, if you're dealing with an illness and you don't feel like you're making progress and you feel like you're getting weaker and you don't feel like the treatments are making a difference, it may be necessary for you to say to the doctor, you know, what is my prognosis? What do you think the future holds for me? And that may open the door towards talking about options like hospice.
And oftentimes I think people are fearful that if they sign up for a program like hospice, that somehow means, as we said, giving up, or that I'm forgoing any possible future treatments if something were to become available, a new drug or a new therapy. But that is exactly the opposite. Hospice encourages those who are under our care. If there is something that comes up that would benefit them, we certainly want them to take part in that. And they are free to leave hospice care for a time and come back at a later date when it's appropriate.
Whether or not you're able to return to your home, or there are people who don't have family members around, it doesn't matter.
Right.
Hospice will work for
Absolutely.
anybody who needs it.
Yes.
Regardless of your circumstances. Just make
And you know what, Linda, specific, maybe I was just thinking that maybe the difference of the approach of hospice. One of the things we would establish with the patient, I often ask the patient, what are your greatest fears about the end of life? And if somebody says, well, I don't want to suffocate, or I don't want, we can sort of tell them and talk openly about it, and in most cases we can guarantee that we can avoid that. They do not have to go through that. So that's a real benefit.
Well, it's 24/7, right? I mean, it's not.
In terms of our ability to support them, we are dependent upon family members in the home setting or other caregivers to be supportive. We're available by phone 24 hours a day, 7 days a week. We have a nurse who is available to provide consultation, and we have nurses that go out into the home 24 hours a day, 7 days a week as needed as well. And one of the most powerful components of hospice care is our volunteer program, which is another way that we provide support. Oftentimes we find in our elderly population that it's an elderly spouse caring for one who is ill and on hospice care, and they're needing respite support. So our volunteers provide that to give them time to go out and do shopping or spend time with other family members. And also there's a lot of loneliness that those persons feel as their disease isolates them from their community supports. And as Dr. Brown said, that death phobia kind of scares off people around them as well. So the volunteer provides companionship and support to help that person to cope with that illness and to help family members cope as well.
Now, everybody may not think they're strong enough of a person, or they may not want to become that emotionally attached by maybe volunteering in the home, but there are support positions as well where volunteers can help make a difference.
Right, we make use of volunteers in the home, in the other settings we've talked about where hospice care is provided, but also we have volunteers that do bereavement calling for us by phone and do phone contacts. We have those that also help in the office with various tasks as well.
A particular time commitment that you're looking for?
We usually look for someone to be available approximately 2 hours a week for 1 year. We try to get a year commitment because there is extensive training that we provide so that they feel competent in what they're offering to our patients and families.
What type of a person are you looking for in terms of a hospice volunteer?
You know, it's very interesting. There's almost a selection process that takes place that people who work in hospice and even the people who volunteer usually come in with the right attitude and the right value system. People usually don't want to get into this field unless they have a genuine interest in people, maybe some personal experience with hospice with a relative, recognizing the incredible support it can be. And I just want to go back and add to something you said. I was thinking of figures with many, as people sometimes don't know, that Alzheimer's, which is an epidemic, it's really a plague of our generation. We now have 4.5 million people with this, maybe looking at 12 million, 2040, 2050, unless we get better treatments. But the caregivers, by the way, not surprising to you, are 80% women in our culture. But just this figure is mind-blowing in a way to me. 50% of caregivers who are taking care of dementia, which is a drawn-out thing, but a terminal illness, 50% of the caregivers develop a biological depression. So it emphasizes what you were saying earlier. We see the family and the caregiver as a unit and give a lot of care and attention to the caregiver to maintain their health and integrity. So I think that's an important issue too.
It is. And we have, again, still some more to talk about when it comes to hospice care, and we will be joined by a new guest when we come back, so stay with us. Hello and welcome back to North Valley Viewpoints. Today we're talking about hospice care, and we are rejoined by Bronson Pittman, who is chaplain at Butte Home Health and Hospice, and also Amy Asher. Thanks for being with us, Amy. Amy is a social worker with Community Care Options. And Amy, if we could begin by explaining exactly what is Community Care Options.
Well, Community Care Options is a small business in Chico that is a senior referral and placement agency for no cost to seniors and their families. We do assessments and we help the elderly find the best placement possible, if that's staying at home or going into a facility. So we do assessments and look at their level of care. And then we also do education in the community for caregivers and administrators of facilities.
It's a tough point in a family's life, if you will,
Yes.
at which point you have to consider placing your loved one outside the home. I mean, even just considering it, I think brings a lot of guilt for people.
Oh, definitely. There's a lot of resistance, and I talk to family members all the time about, how do I get mom to, move? How do I encourage her to do that? And it's definitely not an easy process.
A lot of guilt. You were even talking about that, how we deal with that, need to deal with it.
It's again an acknowledgement on the part of the family that the person's needs are increasing. Oftentimes the person is entering hospice care at the same time, and we're trying to partner with Community Care Options to find a place where they can receive that 24-hour support that they need, because family members are stretched so much in trying to provide that within the home setting.
Because not everyone is able to quit their job and stay at home with a loved one, and even if you are, that can bring a lot of consequences for the person who is staying at home.
Definitely. For their own health as well as financially, it means a tremendous sacrifice.
So you work very closely then with hospice and educating
Yes,
people about their
most of the clients that we're serving are facing the end of their life, some of them are on hospice. So we're looking at facilities that are able to meet that hospice need, so they can die in their own home, even if it isn't a facility.
Your mom was the founder of the business, right?
Yes.
And I know she was also very active in hospice.
Yes, she was, and she recently passed away from a 2-year battle with cancer. But prior to that, she started community care options, and she worked in hospice and educated people and taught classes on hospice. It was really she was very passionate about hospice and the quality of care for seniors.
And you said even still, it was a struggle for you to actually make that decision to get involved with hospice care for your mom.
Yeah, we both were really reluctant. Having both been social workers in the field, we had family discussions, and for some reason we just really didn't want to make that acknowledgement that it was time for hospice. But we're really glad that we did, because it made an incredible difference in her quality.
How did it help both your mom and your family, yourself?
Well, yeah, there was many benefits. I think most importantly, as soon as hospice came in, Butte Home Health came in, her quality of life increased in a matter of a couple of days, because they were able to, with Dr. Brown, look at her medications, make adjustments so that she was comfortable. She had a lot of symptoms. They were able to quickly go in and fix that. And what was neat is that then she was able to interact more with us. We were able to have quality time with her. During those final weeks, she was able to request people that she wanted to see. Just her quality went up, and that was wonderful.
And made it easier for you as a result, because obviously she was your first priority.
Yes,
and
absolutely,
her needs.
Absolutely.
I think that points out one of the strengths of hospice care as well, is that ability to respond quickly, which we saw with Eileen. And Eileen, both a professional relationship that I had with her, as well as being a personal friend, someone that I really relied on over these last 8 years that I've been involved in hospice care. And we were able to bring medications. If one thing didn't work, we tried something else. And there isn't the delay that you often have in going back to the physician, waiting for orders to be written, waiting in line, long lines at a pharmacy. Things could happen much faster, and we often would bring out the medications within hours, I believe. I think,
absolutely. And the environment was so nice. I mean, I don't think there's any replacement for being in your own home. And we were able to make her room, just as she wanted it. We could sleep there. We could come at all hours. We could make it very peaceful and quiet. I mean, I've been in a lot of hospitals, and it's really hard to find peace, quiet. Soft music, aromatherapy. We're really able to make that environment very nice.
Advice you would have for family members as they set out upon making that decision or reaching out?
Yeah, I just think that not to wait, and that what struck me, and Dr. Brown mentioned this, is that bringing on hospice doesn't mean that you're giving up hope. And I think I had to be reminded of that too, is that you don't have to give up hope, and for families to keep that in mind.
You would add to that.
Right, and the benefits of that is coming on at a point where we can provide that real support and improve and enhance quality of life. And Eileen, in particular, had weeks then where she could have that engagement with family, and she was one, being a social worker, she knew the kinds of things she needed to do to express those deep emotions that we have for one another. And hospice, when you recognize you have a life-limiting illness, suddenly all those important things in life really come up to the surface, and you're able to say, I need to see this person, I need to talk to this person, I need to be able to share my life with that person before the time comes. Whereas if you don't acknowledge that, so often the conversation is impeded because no one wants to talk about those things. I don't want to say goodbye because I'll see you again. I'll see you next week, next month, next year, and there's a real lack of reality that people experience.
Yeah, I mean, there were most days she would have a list of people for me to call that she wanted to have brought in to see and talk to, and that was really neat. And I also wanted to make the point that Butte Home Health was great with educating us as a family on how to care for my mom, and so we got to be included in that process. And I think back on that, and I'm really grateful for that we were able to help care for her, and we were educated and having conferences and always knowing what was going on, and that was just really nice.
And we have about a minute left. We want to tell people where to go for more. You know, they want more information, whether it be just about hospice, possibly interested in I know there's some websites. Butte Home Health Hospice has a website.
Right, buttehomehealth.com is a resource that people can access. If they're in other surrounding communities, to contact the local hospice organization in their community, speaking to the physician about it. Home health agencies often have relationships with hospices as well, or the hospital. All those are various avenues that people can choose, and organizations like Community Care Options is a wonderful resource for families who are struggling with these care issues and end-of-life issues.
So many families are. Again, some really good information, and thank you both for sharing with us. And we encourage you to look for yourself, to go online, to pick up a phone, to feel free to inquire more about hospice if you have any questions that need answered. Thank you both again.
Thank you.
Appreciate it.